Let me talk about how we are integrating a PROM solution in our Catalan health system. Before talking about, before delving into this specific solution, let me give you a brief overview about our Health Catalan model and our ICT model, because it's a huge there is a lot of heterogeneity. We have different information systems in different hospitals, and it's a complex ICT model. So in Catalonia, we have a model funded by taxes with copayment in pharmaceutical products, universal coverage and free access at the point of delivery, extensive range of public covered services, and service provided mainly in public facilities. We have a multi-provider model with more than 160 providers with more than 28 information systems. It's only if we talk about hospitals. There is more information systems in other levels of care. But all of them are integrated into a single public network. We have 70 hospitals, more or less 300 primary care centers, and 100 intermediate care centers and 91 mental health care centers. This is the map that we have in information systems. As I said before, we have more than 28 health information systems in hospitals, but recently we have achieved, we have reduced the number of information systems in primary care centers, and now we are a unique information system. It is an old information system, but we have a unique information system in primary care centers. During these years, in Catalonia we had deployed an interoperability model to share information between different levels of care. And in 2007, we built a shared clinical record, is HC3, is Historia Clínica Compartida de Catalunya in Spanish, that allow us to share information between different levels of care and different health information systems. So through different web services, we share information, and we can share this information through web services, or we can see the information in a screen that the tool offers in each health information system. We add the electronic prescription and the image, and 2 years later we integrate our PHR in this portal. So since 2009, each citizen in Catalonia can see the same information that a health professional can see in the doctor office online, because we are in the same repository of data. Okay. In the PHR, we deployed our remote strategy, and we have different virtual visits. And in 2014, we deployed a new cross-platform, not to share data, but to share referrals and electronic referrals and alerts between different information systems. And now we are deploying a new cross-platform to collect all data come from different devices and apps, and data come from the citizen, and different information systems can collect what information they need. So not all data goes directly to information systems, that we have this layer between them to select. Doctors can select what information they want of these apps or application. Okay. This is our interoperability model, but now we are evolving to unify all these ICT, this heterogeneity of model of information systems, and we are evolving, and we are building a new electronic medical record that replies the old electronic record, and we add the old workstation and primary care centers. We unify the databases of this electronic medical record, and we deploy a new electronic record for primary care centers. And how we are doing this? With a microservice strategy. Why? Because we are trying to build this new electronic medical record for the use of professionals in primary care centers, but we also want that hospitals can use these microservices, and we collect the data they are using. Excuse me. The data. These microservices are used by primary care centers with the electronic medical record, but we store the information if each hospital connect through API these microservices, and we store the information in our clinical repository of data of this electronic medical record. Okay. And we are deploying with these microservices, but we start with non-nuclear microservices to gradually build this new electronic medical record. And what were these non-nuclear services? We start with integrate an integrated app to take pictures of dermatology, and we integrate this image, and a landing page is the first screen that we offer to professionals to enter this new electronic medical record. And in this landing page, we include these microservices that we are building for this electronic medical record. Okay. This is the landing page, and here we have PROMs. It's a new microservice that we have built, and we are integrate in our first screen of the new electronic medical record. So a practitioner of primary care centers or in a hospital, if they are integrated this service, they can see the same information in different levels of care. And here we have different citizens with different prompts that we have, they are answer prompts that he has sent by professionals. In recent years, there has been an increased focus on placing patients at the center of healthcare in order to improve the experience. And PROMs are health questionnaires that are often self-completed by patients to obtain health outcomes. But we are measuring not the indicators of health. We are measuring the perceived health of the patient, and this change our usual usual model to think and to understand the follow-up of patients without needing to be present at the doctor office. So this could be an advantage. And so we also have ICHOM, as you know, is an international organization dedicated to promoting the use of standardized PROMs, and the main goal is to drive value-based care, measuring the reporting outcomes that are meaningful to patients. And they are helping us to decide what process, and in the process, when we have to send PROMs in each time of the process. For example, in a stroke, we have to send a PROM when we discharge the patient at 7 days after the discharge, 19 days after the discharge. Annually, we send a PROM, and the patient fill out the PROM, and we include the data into our healthcare system, health information system. Okay, what was the context before building these microservices? We had different hospitals using PROMs with different tools, not integrated in the health information system. Professionals filling out the PROM and not the patient, and spending time to do this or to manually recording this information in the workstation. And we decided to build this microservice, and in order to allow us to deploy a technological solution as an electronic medical records microservice integrated into any health information system of the Catalan health system. The professionals access with single sign-on. They don't. It's clear for them, and there are two ways to use these PROM services: sending and receiving results integrated into the professional workstation, or using the screens that offers the tool, and only integrating these screens is a low level of integration for each health information system. And we also have integrated the solution in our PHR. So the patients enter always for through the same door is our PHR. It's a secure environment, and we are trying to integrate the PROMs in the normal workflow of the professionals. And we have had a monitoring response status, receiving response notifications, sending reminders automatically, and consulting the evolution of patient results. In fact, we have 3 levels. Practitioners from primary care centers can send a PROM from a hospital or from our shared medical record. So if you are a small hospital that you can integrate these microservices, you can use the screen of our shared medical record, and you can send and receive a PROM. So we are arriving to more than 1,000 healthcare centers to do this kind of solution, to use this kind of solution. When a professional sends a PROM, we standardize the PROM. We translate in Catalan and Spanish this PROM. We have a procedure with the author of the PROM to standardize the PROM and the last version of the PROM and the ICHOM version, etc., etc. And this PROM goes to the PHR of the patient, and we notify with an alert, an SMS or mail to the patient, and the patient go to the PHR and answer this PROM or respond the PROM, and this response go in an integrated way to different health information system of all levels of care in Catalonia. Okay, this is an example. For example, this is our old workstation in primary care centers, and as you can see, is very old. But now we are integrating with these microservices. So the doctor goes to prescribe a PROM, and it opens the screen of the microservices, and he also have different the professional screen when he can see all patients that who he has prescribed a PROM. Okay, this is another workstation. This is a sub integration with a hospital, and this hospital has decided not using the screens of our solution. It takes the data of an algorithm and integrating their workstation, and this is the integration that we have. The AC3 integration, so each healthcare center can connect and can interact with this screen and send and receive a PROM. In fact, we have 3 main screens: the prescription screens, the result screen, and the professional screen when we can see different citizens. And the doctor prescribe a PROM, send a message to the patient. The patient go to the PHR, and in the PHR we automate the reminders at 7 days, 14 days, and 3 days before 30 days if the patient has not responded the PROM, and the patient goes to the questionnaire, fill the questionnaire, and he can select the language, and the result come to the health information system. If the PROMs, for example, depression PROMs, has a critical alert, for example, risk of suicide, the professional has a notification, and he can consult this notification, and he knows the risk of this patient, that this patient is not with us, is at home, but we know that he is with risk in this moment. And this is the screen of professional, and now currently we have 27 kinds of PROMs, and this is the evolution of our project that we start. We integrate with the workstation in January of 2023, and we start with 3 PROMs. So, and until 2 months ago, only we had PROMs from primary care centers. When we start, when we integrate this solution in primary care centers, they don't know what it was a PROM. Okay, and because usually is used in hospitals, not in primary care centers. But only primary care centers has sent more than 70,000 PROMs in these few months. It's amazing. These are the results. We have almost 70% of response rate. Is a huge response, and 5 days more or less on average of the response of the PROMs. The key points are that these electronic PROMs make it easier for patients to fill out these questionnaires, reduce time to professionals and avoiding recording the results in health records. And PROMs must be integrated in the health information system and in the normal flow of the professional. PROMs are shared by different levels of care. We standardize these PROMs, and these are fostering us to deploy new healthcare models, especially new in primary care centers. And the next steps are following up to integrate with the rest of hospitals, include new PROMs, and start to make benchmark strategies in some kind of processes, and initiate some lines of research and screen to, and also we are developing a new screen to share the evolution of the PROMs in the PHR and in the screen of the professional to see what is the evolution of my PROM, and include also PROMs in an automation in digital telemonitoring processes, not only sending PROMs, but we also want to have an holistic view of the process, and probably this electronic monitoring of this process, send a PROM or make a televisit or telemonitor some clinical variables in the same process. We are combining PROMs with other kind of telemonitoring and televisit solutions. Thank you so much.